Good afternoon. I'm Stephen Marsh, practicing medical physicist, diagnostic imaging physicist, here today to speak to you about the use of Xofigo 223 and the process and steps needed required for a small community hospital to add that to their clinical practice.
What would be the steps necessary to be taken by our facility to be licensed for this treatment?
From the Radiation Safety Section, or acting as an RSO, my first question is to review our radioactive material license. From that radioactive material license, are we, as an institution, able to provide this service? This typically will involves reviewing our radioactive material license, understanding, doing a little bit of research where the drug comes in from a radioactive material license, whether it's NRC or state agreement state, and once we have identified it, most likely we'll have to provide and do some type of amendment with our regulatory institution to add that service to our institution's radioactive material license. If we provided service, it then entails reviewing are we a broad scope. If it's a broad scope, the process may not be as involved. If it's small community hospitals that are doing many of this representations, limited specific, then it tends to be a little bit more a process, or maybe a lengthier process.
And what's the typical lead time for this process to get licensed?
Again, at the judge, it could typically be, I would estimate, about 2 to 3 months from the start to finish.
Okay. So once approval has been received, and what are the steps necessary to move forward on this?
Probably one of the first steps is, well, the manufacturers will reach out to us, and we need to probably provide some type of training. They typically like to provide at least an hour training. Seeing that this process is very similar to earlier treatments used, either strontium-89 or samarium-153, from a physician standpoint, it's very, other than giving them the background information on the drug and its use and how it's administered, it's fairly straightforward. The staff, also the nuclear medicine staff, would like to have some type of training. They're given the same type as well. The next step is probably to identify and speak with the manufacturers in the exchange of the radioactive material licenses. Also, at that point, the manufacturer provide the institution with a standardized dose so that we see that our dose calibrator is set up so that we ensure that when we do administer this radioactive material, we're administering the correct amount to the patient. That goes along with our written directive, seeing it's a therapeutic agent, identifying the patient, seeing that the patient meets the guidelines and procedures and policies that enables the individual to participate. We'd have to have a written directive, and that's from the physician, one of our authorized users physicians, who was previously identified via our amendment, that the dose, the patient's name, the activity, in the route administration we provided. Then at that time, the individual from nuclear medicine most likely would probably put in the order with the manufacturers. At that point, the nuclear medicine staff will probably be responsible for ordering the dose from the manufacturer. The patient's date will be set for the clinical. On the day of the treatment, the staff will most likely receive the radioactive pharmaceutical, much like they do all their other treatments for the day, checking it in, checking to verify, include it in. Prior to the patient administration, the staff will verify that dose calibrator's activity is within the physician's written directive, and indeed if at any point there was a discrepancy, the nuclear medicine physician authorized user will be notified. The patient will be brought to the treatment area. The physician typically would meet with that individual, go over the risks, the safety precautions. Many institutions will provide that patient with a card to let that individual know, to carry with them in the event the potential is to set off any type of radiation detection monitors. The likelihood is very small. Again, the radium's a 223, it's an alpha emitter. Most of it is probably going to be absorbed by the individual's body. However, we do like to cap them and ask them to carry that through their next treatment for 30 days. At that time, the doctor is convinced, the doctors and the patient are understanding and comfortable, they'll proceed with the treatment. And at that time, they would probably provide some type of IV inserted into the patient with some type of butterfly. The physician will check that and verify that there's either through a three-way stopcock that the IV is patent. They'll again ask the patient one more time if he or she has any more additional questions. And then for that time period, the doctor will deliver the dose slowly over about 5 or 10 minutes. As well as they'll have an open line running some type of saline or D5W to see that the drug does get through the administration set as well. Once it's been completed, the patient will be checked again prior to that by radiation safety for the exposure to see that their exposure meets within the release criteria. That's no more than 1 MR per hour. We need to go back prior to that as well. We'll do an initial survey with an ionization chamber to verify that that patient has not had any other nuclear medicine procedures would warrant or give us any unusual high readings prior to the treatment start time. And then the patient's happiest time is they'll say goodbye until we see them 30 days later.
Great. Well, thanks. Thanks for your time for this, Stephen.
You're welcome. Thank you. Thank you for having me.